This is an eyebrow hair transplant, and if you're someone who happens to have thin eyebrows, maybe from overplucking or you have an underlying medical condition, well, you're in luck because this procedure allows you to have permanent results so that you can have thicker eyebrows. And the trend now is actually to have more dense eyebrows. So what we're going to do today is explore with you what this procedure is all about and how you can get great results from an eyebrow hair transplant. For those of you who are new to our channel, I'm Dr. Ross Kopelman.
I'm Dr. Joel Kopelman.
We are a father and son duo, and we cover a lot of topics on hair transplants, so make sure to hit that subscribe button and let's get started.
There are many reasons why people have lost their eyebrows. Overplucking certainly is the most common cause of eyebrow hair loss. However, there are other medical conditions that may lead to hair loss of the eyebrow. One of them is hypothyroidism, where your thyroid levels are low. You can actually get thinning of your brow. And these conditions, by the way, have to be addressed medically before we even consider doing a hair transplant. You have to make a good diagnosis before you proceed to a brow transplant. You just don't automatically do it if you have thin eyebrows. You should know what you're dealing with. Now, there's other conditions like there could be trauma, there can be skin conditions like eczema or psoriasis, and there are hair conditions also called frontal fibrosing alopecia, where you lose the lateral portion of your eyebrow, alopecia areata, where you can lose the entire eyebrow hairs. Those conditions, some of them preclude us from actually doing hair transplants on them because they're not good candidates for hair transplants, period, because the hair doesn't take in those areas. So you really have to have the right diagnosis to begin with in order to proceed towards a hair transplant procedure.
So Dad, let's get into the nitty-gritty and talk about what eyebrow hair transplants are all about. And I think where we start this discussion is we talk about eyebrow hair design. Because when we look at our patients, we have to really distinguish a design for a male versus a female. And there's very big differences that we really have to consider.
So let's talk about eyebrow design, because getting the design right from the beginning, before any surgery happens, is so critical, because if you don't design it correctly, your outcome is not going to be natural. You've got to get a natural look, and it's based upon very exact details in terms of designing the brow correctly. And we differentiate between a female brow and a male brow. Now, in a female brow, in most cases, there's an arch to the brow. So when we look at a brow on a female, we look at where the arch is. So the arches can be anywhere from what's called the lateral limbus of the cornea to the lateral canthus of the eyelid. So it's in that segment that we consider to have the highest arch. And that arch peak, so to speak, is determined by the patient themselves, because they will come in and actually pencil out exactly where they want their arch to be. And that communication between the surgeon and the patient is critical, because we want to ultimately get the design that they desire and not the one that we think is the most beautiful. We want them to decide where the ideal arch is. Now, talking about a male contour, which is obviously a much different contour than a female, we're going to use Ross as an example.
Okay, let me get close to the screen so they can all see.
Okay, so here we see Ross's brow is relatively straight. There's no arch like that. Arching implies or sends a message, a more female, feminine type of imagery to the person looking at them. So in a male, it's straight across. And we like to look at the bridge of the nose and the non-arch of a male as being a T-shaped. Okay, now he does have a few hairs that are in the lateral portion of his eyebrow here that kind of gives a simulates a brow elevation, but it's actually not. His brow hairs are just drifting up a little bit further north, but in general, a male brow is horizontal with thick density primarily in the center of the brow and a much thinner trailing single hair density out at the lateral portion of the brow. So we take into account all these contours, again, to achieve the most natural, appropriate contour for whoever is sitting in front of us. So that may be male or female. Each detail has to be taken into account.
When we're looking for the best hair to transplant into your eyebrows, we're looking for three characteristics. We're looking for texture of the hair, thickness, as well as curl. And those hairs usually come from the back of your hair in what's called the safe zone or the nape of the neck. Sometimes if you're a male, we'll use actually your beard hair. And if you're a female, we'll sometimes occasionally use pubic hair. All three areas have great characteristics that mimic eyebrow hair. There are two approaches to removing this hair. If we're taking hair from the back of the scalp, we're doing what's called the strip technique, also known as FUT. We take a small strip that's removed from the back of the scalp, and technicians then very carefully dissect the hair follicles so that we have both 1 and 2 hair follicles that can be transplanted into the eyebrow. If we're taking hair from the body, whether it's from the chin or from the pubic area, we use a technique called FUE, where we individually remove follicles 1 at a time. I want to add that sometimes we perform FUE as well to the back of the scalp when we do eyebrow hair transplants, but specifically we do this for men who want to wear their hair short, because they would not necessarily be candidates for an FUT strip technique.
When we take these hair follicles, by the way, we keep them long because we want to actually see the curl of the hair as we implant those hair follicles into the eyebrow. If we cut the hair too short to begin with, we can't see that curl. So we want to keep the hair follicle long so we can actually see how the curl fits onto the brow in a natural way.
When we do hair design, you can get anywhere from 200 to 500 hair follicles for each eyebrow, and it really depends upon how much hair loss you have in your eyebrow. Sometimes patients come in and they have tattoos, and there's no hair whatsoever, so they're going to need a lot more hair follicles there to create a natural appearance. But in some cases, they just have some mild thinning. So it really varies in terms of how much hair you're going to need to be transplanted into your eyebrows. And again, there's some slight differences between men and women in terms of how many follicles they need as well. Men tend to have bushier eyebrows, women have little slimmer eyebrows, and so don't necessarily need the same amount of follicles.
So it's critically important when we create what's called a recipient sites on the eyebrow area. A recipient site means we are creating with a needle tiny little holes where the hair is going to be inserted into the eyebrow deficient areas. And it's critical the way we do it. We have to change the angles constantly because that's the natural way the hair arches over and cascades downward. It's also important that we take very low angles to the hair insertion sites because the hair naturally grows somewhat flat to the skin. We don't want hair growing vertically out, and that would create a problem for you to continually trim the hair and flatten the hair out. So we want the hair to grow naturally in a flat way. Also, it is part of our the expertise of this procedure comes from the staff that we hire who have experience in handling the hair follicles. So the hair follicles there are single hair follicles and double hair follicles that we use, and the person inserting them has to handle them very gently so that they don't crush the hair follicle so that the hair doesn't survive. They have to have the right touch to insert these hair follicles in a way that is atraumatic, and also they understand the angles and the contour that we're trying to achieve. So it's a teamwork that ultimately achieves the best outcomes.
So now let's talk about the recovery process from an eyebrow hair transplant. I do expect that you're going to have swelling and bruising that's going to last for up to 2 weeks. This swelling can happen in your brow area, under your eyelids, as well as in your cheeks.
I got an eyebrow transplant 7 days ago. I had a bunch of bruising and swelling, but it's actually starting to go away. The eyebrows are starting to scab, and they will definitely look different.
Now, the other thing that's critically important is that you're very, very gentle with how you treat your eyebrows after the case. You don't want to go home and jump into the shower and spray your face. Instead, I would say avoid the shower for 3 days to allow the follicles to really get implanted correctly. With that said, we do send you home with the spray to keep them moist and clean, but you got to be gentle. Do not forget that. Now, if you have any pain, I don't think narcotics is necessary. Instead, Tylenol should be more than adequate. Now, the other thing that is so important to emphasize is that the hair that we implanted will fall out within 3 weeks. Not the entire follicle, just the shaft. This is like planting seeds like grass. It takes time to grow. You should not expect to see the final results for your hair eyebrow transplant for up to a year. So it takes time for this hair to really grow in. So don't be afraid when hair falls out initially in those first 3 weeks. We've given you a comprehensive overview of eyebrow hair transplants, why they're done, how they're done, and how to recover from an eyebrow hair transplant. If you have any questions about this surgery that we've not addressed, please leave them in the comments below. We really both make an effort to answer questions, and we answer a lot of questions. Anyways, we'll see you in the next one.